Addiction incidence and prevalence is skyrocketing in recent years. Why? I have several theories about rises in addiction incidence and prevalence. And, if we map back to 1980, which, oftentimes people mark as the beginning of the quote unquote obesity epidemic, right? Where people were consuming much more highly processed, ultra processed food, we're now calling it. And there's some really interesting data. And one of my early papers in the Appetite Journal was looking at the animal data, which is rodents and rats and mice, about how what a mother eats during pregnancy can actually affect the neurodevelopment of the offspring. So there was lots of studies that showed when mothers eat cafeteria food, Oreos, chips, sugar, butter during pregnancy, it can actually program the offspring to be more susceptible to addictive processes. So their babies were more likely to get hooked on meth and cocaine, right? So let's think about a multi-hit model where we have people eating more processed food throughout their lifespan during pregnancy, right? And then children are being born with higher levels of susceptibility to addiction-like processes. And then you mix in the internet era, right? Where people are learning from an early age how to be engaged, right? We've got the app. So people that were born, you're talking about this current generation, people that were born in the year 2000, right? There might have already been a susceptibility to addiction-like processes. We got the smartphone tech addiction thing blowing up. There's a lot of unrest in society. There's a lot of social justice movements. People are more susceptible to stress, trauma, and adversity. There's much more social disconnection. So and much more highly palatable foods, much more access to things like you said, vaporizers, et cetera. When you mix all of that in, you're priming someone's biology for addictive processes. And probably more importantly is that we live in a world of corporate greed where companies are studying these things and learning how to maximize their profits at the expense of public health, right? They're literally in laboratory using neuroscience data, finding out how to make the food more rewarding, more palatable, how to make the vaporizers hit the brain in a different way. And, I think when we talk about sugar addiction and food addiction, I do individual level treatment, but I think the public health conversation there is also super important to think about how, food addiction is a conversation that implicates policy and big multinational food corporations. And I think that's a lofty goal to try to change the kind of corporate structure of our world today, but I know people are working on it, and I think that there's some value there.